be here. Oh, I think it's working, right? And thank you to the members of the Youth Parliament for a very interesting session just gone. That's fantastic. Thank you to Chris and to Amy, to Enlighten, to Chest, Heart and Stroke Scotland, and to your colleagues for inviting me to speak today. As Amy said in the introduction there, you'll have probably seen some of this covered in the media today. So there will be some of this at least which is familiar, but I'll go into a bit of detail. I see this very much as a kind of a start of a conversation. I'm not going to stand here for sort of half an hour, 40 minutes, and pretend that what I'm going to present is the answer to what the public thinks. It's a snapshot. We need more in-depth conversations. We need to kind of understand what people are thinking in a much greater level of detail than what I'm about to present. And actually, I'm quite heartened by some of the discussions I heard earlier on this morning that alluded to that fact. Having said that, I think what I'll go through in the next wee while should give decision makers, whether that's politicians, whether that's people, decision makers within healthcare in Scotland, some cause for at least kind of mild encouragement, I suppose, that people are up for change, more than up for change actually, are quite demanding of change, because the less good news, as many people sitting in this room will know, is that broadly speaking, most people do not think any part of the healthcare system in Scotland is working particularly well at the moment. So that is the driver of change, as I will begin to demonstrate in a few minutes. The trite bit of this, of course, is that it should go without saying, but I'll say it anyway, that anyone, whether you are in the political world or whether you're a decision maker in the healthcare system, at the very basic level needs to know what the public is thinking, even if you want to kind of challenge that, even if you want to do things differently, which is fine, of course. But you need to know what the public is thinking. You need to know it in a great level of detail. So, with that introduction, we will crack on. There's a nice big screen behind me. In fact, it's huge. So you should be able to see all the numbers. As anyone who comes to listen to me rattle on, whether it's about the NHS or anything else, there's always quite a few numbers. We will obviously share all this data. It's in the public domain. So if there's, I won't go into every single number that's up on the screen in great detail. I will pick and choose some that I will go into. But the background to this, right, a little context. There are two things really. One is that anyone who comes along to our quarterly sessions with the David Hume Institute, which talk about our data from our regular Understanding Scotland series, will be familiar with this slide, which basically tells something very straightforward, i.e., it's not actually loaded properly up there, and you can't actually see it, which is a bit of a shame. The yellow line at the top there is actually what this chart does is show what people say are the important issues in the country. Unfortunately, I don't know, somewhere in translation, somewhere across the ether as we sent this, it's got lost. But you can take it from me that there's a yellow line there which shows that actually the number one issue that people tell us is of concern to them is the NHS and healthcare. And if you see there that cost of living and inflation is 37%, it's 45% most recently for the NHS. In other words, it's the issue that matters most. It's a single issue that matters most to the electorate in Scotland. And that's the case whether we're about to embark on an election, which we are, or whether we're not. It is absolutely fundamentally the thing that people care most about. The second bit of background, I think, is that it's not unique. There are plenty, and we've heard from people from overseas working in different countries already. today. You can go and have a look at kind of international studies on public perceptions, and you see something that is pretty familiar. This is not a Scotland or UK-wide, a problem in isolation, what I'm about to present. Nor is it unique to the countries that have the type of healthcare systems that we do. People across the world are pretty fed up, actually, with the standard and provision of healthcare, and actually particularly in Europe, and particularly in Western Europe. And given that there are many different models of healthcare in Europe, there is something more going on here than the different, the NHS or the social care model that we have. We are far from unique in that regard. So I think there's sort of two bits of context. Now, okay, good. Hopefully, from now in, we can see everything. We can see everything properly. So I want to do three things really. I want to talk first about what the public perception for the need for change or reform. Reform is a word in my world which you have to be quite careful using, obviously, because it means sort of different things in the political world. But change, I'll use the word change. We want change, both in the NHS and in social care, and I'll come on and talk about that in a moment. But I want to do three things. One is to talk about the public perception of the need for change and the performance of the NHS and social care. Secondly, I want to just have a brief look at the challenges that the public identify as being the key ones that actually underpin that desire for change. So why do people want the change? What are the challenges that the public sees? And then thirdly, a few words just on the future. What do people think the future should look like? And you can see here, this is the kind of headline data that's been leading much of the media coverage of this today. And you can see like an overwhelming, you don't need me, you don't need to be a kind of data expert to understand what's going on here. We want things to be different, whether that's in the National Health Service on the left there, or whether we're talking about our social care system. So in each case, about 9 out of 10 of us want things to change, want reform in those services, and that underpins, I think, everything that I will talk about for the rest of this presentation. And we want that change particularly as we get older. So as ever, when you do a bit of diving into data, you see things that are interesting, insightful, raise questions as you try to understand what's going on in a bit more detail. These are the proportions of the public who want significant change, right? So overall, as you've just seen, about 45% tell us they want significant change in the NHS and 51% that they want significant change in social care. And you can see how that rises. It's not quite a linear relationship, but it's as good as, pretty much. And what this may be a factor of is not necessarily age per se, but your levels of use of these services, right? Because that will be kind of significantly correlated to age. I mean, I would draw your attention particularly to the social care, to the right-hand side of that, because they are, we're looking at about sort of 2/3 of people age kind of 55 and over, who are much more likely to either be in social care or need social care, or I would argue to have parents or older relatives who are needing social care. So these are people generally who are at the sharp end of this. So the need for reform is absolutely related to how old the respondent is, how old the citizen is. And this is very busy. There's a lot going on in this slide, and I want to sort of break it into three. So the second part of my first point is around perceptions of performance and principles as far as healthcare is concerned. In performance terms here, we can see something fairly stark, which I think will probably not surprise that many people in the room, that about 7 out of 10 of us think that the NHS is worse than it was 10 years ago, and an even higher proportion, more than 3/4, actually 77%, tell us that if nothing changes, basically, if the model stays the same, then there is an anticipation that it will be worse again in 10 years from now. So these are drivers of that need for change. This is what's underpinning. These are the experiences that people are having, which are underpinning what we talked about at the beginning about the overwhelming need for doing things differently. So that's performance. What do people want in the future? And I'll say a bit more about this. In a minute. But as far as currently is concerned, I mean, about 2/3 of us think the current model is unsustainable, and about 3/4 of us want more focus on prevention. Now, of course, these are discussions that are being had in rooms like this, in parliaments, in the kind of corridors of power. But it's clear from some of this data that there's not a great deal of confidence that these things are actually happening so far in the real world. And when we look at the desire for change, there are kind of two things, I think, that jump out here. One of which is at the top of that slide, and two of which are at the bottom. There is an absolutely fundamental, overwhelming desire, right? And this will, I suspect, surprise no one or very few people in this room, that the principle of free at the point of use is not to be tampered with. It is not to be, if you want to take the public with you, that challenging that or doing anything different from that is not the way, is not going to be particularly popular. However, you can see at the bottom there's some quite interesting stuff going on around private provision and the acceptance of and the sort of consideration on a personal basis of using private healthcare. Now, this chimes with some work that we did with the BMA earlier in the year, where we found that about 1/3 of adults in Scotland had either had private healthcare or had someone in their household who had had private healthcare. So things are changing dramatically before our eyes. And if we'd been, my argument would be, I think if we were stood here 10 years ago, 15 years ago, having this conversation, I suspect those two bars at the bottom there would look actually quite different. And there is now a sort of greater acceptance. It may be begrudging. It may just be, it may not be what people in an ideal world would want to see happen, but there is a begrudging, or maybe not begrudging, there is an acceptance that private provision is playing a bigger role, and much more of an acceptance that people might choose that. Now, you can go and have a look at this data. We haven't got time to do this significantly today, but the answers to those questions depend on things which are kind of fundamental: what your income is, what your social class is, where you live in the country, the type of area that you live in, and so on. This is not, this varies according to, your attitude to this will vary extremely, significantly, depending on your background and so on. And it depends, your age will play a big role in this as well. And as ever in survey data, there are often kind of different data points that tell you something that appear to be sort of slightly contradictory. So, we looked earlier about how older citizens of Scotland are the ones that are most in favour of reform. And maybe this isn't a contradiction, but older people are also those who are most resistant to using private healthcare, or for an enhanced role of the private sector in our healthcare. The free at the point of use principle is not correlated with age at all, as one would probably expect. If you've got 9 out of 10 people saying something, then you're not going to find a significant amount of difference between different segments of the population, but your attitude to private healthcare is dependent on age. It's dependent on other things, as I was mentioning a minute ago, your social class, where you live, your income, and so on and so forth. And also, one for the politicians in the room, the reason why you'll never get, I don't think, a politician telling you that they'll challenge the free at the point of use principle is there on the right-hand side. It doesn't really matter what political party you support. That principle is not up for debate as far as the public is concerned. But you see in there some fairly, I suspect, familiar and relatively intuitive relationships between who you support's political party and what your attitudes to private provision are. Interestingly, well, there's lots of interesting stuff in there that I won't go into in detail, but there is no, they're quite clustered. They're a bit more clustered than perhaps one might have expected, and that's also worth pointing out as also interesting. My second point I want to come on to. So that's I think what I've done so far is talk about the principles, talk about the need for reform and what the public wants to see as far as that's concerned. What are the challenges that people see facing the NHS? Again, this will be familiar to many people in the room. But, the top three are long waiting times, staff shortages and burnout, and waiting times to see a GP. Now, I've been looking over the weekend at a global 30-country study that's been done recently. And when you average that out, there are countries in Europe, there are countries in Asia, countries across the world, actually. But that global study, the 30-country average, when you ask the same question is, wait for it, waiting times 47%, staff 43%. It's exactly the same, in other words, right? So again, it might vary between countries, but actually globally, my argument would be that we are facing the same challenges, or at least the public is facing the same challenges under our system as in other countries in the world, which I think is really interesting. And there is a consistency. Having highlighted a minute ago some of the inconsistencies in terms of the need for reform, the need and what people think of the performance and so on of the health service. There is a remarkable consistency across different demographies in Scotland as to what the challenges are. Fix these challenges, address these challenges, and you will be everyone will be pleased, right? Regardless of your age, regardless if you're a man or a woman, and all sorts of other sort of demographic variables that I could put up there and you can go and have a look at in the data. The challenges are consistent across the groups. I mean, the age stuff is really interesting, given what I was saying earlier about the differences with older Scots and their views on reform and what's acceptable for them and so on. They're approaching this from the same experiences as younger people, and men and women are approaching it from the same angle as well. So the acceptability of what people want to happen may be different, but the challenges that people are facing are exactly the same. Turning specifically to social care and what the challenges are in terms of perceptions of social care, and I think here there are three specific challenges that this data throws up. One is I think perhaps don't see social care as the priority that we see at the NHS in. So I guess there's work to be done in terms of raising the profile of social care in terms of public priorities. There's a real lack of awareness actually about how social care works and how it's funded. Perhaps surprisingly, perhaps unsurprisingly, I think those figures are quite low. And then thirdly, the figure at the bottom, from what I know or have experienced, the social care system is working well. I mean, that's just over a quarter of people who think that is the case. There is a significant amount of work to do in terms of perceptions of the performance of our social care system. And again, and I think this is probably one of the sort of key slides here, is that in terms of your perception of the performance of social care, it's actually those that are most likely to need it who are the most critical of it on a range of measures, as you can see there. I mean, what's really interesting is that older people are less likely to know how it actually works, which I find pretty astonishing, really. But anyway, that data is there, and it's fairly clear and consistent pattern. My third and final point, having talked about the need for reform, views on performance of healthcare in Scotland, and what people see as the challenges, we asked some questions around what do you want to see as far as the future of healthcare in Scotland is concerned. And we asked this in two ways. We asked a kind of long-term vision, which is what you can see here, and then we asked about some kind of quick wins, if you like, or some sort of policy, some policy changes that might help. Here's the sort of long-term stuff here. These are column percentages, by the way, so you have to look at 1, 2, 3, 4, and 5. Read down rather than across. And we put kind of 5 principles to people: sustainability, equity, accountability, choice, and innovation. And we asked them to rank them in order of what they saw as the most important as far as the future of healthcare in Scotland is concerned. And you can see the answers there. So the ranking of the most important, which is number 1 there, is 30% of people said sustainability was the most important, 23% said equity is the most important, and so on. And so you can see how that goes down there. So, sustainability financially and operationally is seen as the most important thing for 30% of people. Okay, and again, we don't really see huge amounts of difference here when we sort of start digging into the data and breaking it down. Young people are more likely to tell us that equity is the most important thing for them. So those aged 16 to 24 said that equity was their number 1 priority as far as those principles were concerned. But across the board there, I would argue that there isn't a huge amount of difference. And then finally, what about the shorter term? What can we do in the short term to alleviate things, perhaps to try and make things a bit better? And there's a mixture here of we presented people with a range of policy options and asked them, which were acceptable. I think there's some quite interesting stuff here. There's a mixture of financial, non-financial, and kind of individual responsibility measures that are here. And I think the data that comes back absolutely identifies that it's a spread of things as far as people is concerned. There's no kind of magic. There's no magic bullet to this. Certainly, taking funding out of the NHS to fund social care, given that that's seen as being extremely problematic, as I was saying earlier, is not the way to do it, surprisingly. Or, sorry, I was being sarcastic, unsurprisingly. You can't really, I don't think you can really tax your way out of this as well, would be something that I would get from this, not entirely. Anyway, I think people see the role for more non-doctors, nurse practitioners and so on, to lead care as a way of kind of alleviating some of the sort of capacity constraints and resource constraints, and introducing means testing so that higher earners contribute financially towards non-urgent or elective healthcare services that they use, is something that I think is, according to this poll, and there would need to be much more work done, as I said right at the beginning of this, on public attitudes. But certainly I would flag that as something that does look as if it would be worth exploring more as far as kind of public attitudes are concerned. And again, there is a fair bit of consistency there. The top three overall, which we saw earlier, are all in the top three in terms of acceptability, regardless of age or sex. So there's a consistency here about what people see as the kind of shorter term measures. But as ever, there are barriers. The public see lots of barriers. I mean, the barriers, in a sense, are kind of a reflection of the challenges that I talked about a bit earlier on. So, again, quite unsurprising, I think, in some ways. You know, for example, you heard me earlier talk about, you know, workforce shortages and burnout being a significant challenge that people have recognised, and therefore they see workforce issues as being a significant barrier as well to making some of the changes that we asked them about in the survey. Okay, I said to Amy I'd leave a bit of room for questions. I think we've got sort of 10 minutes or so left. Is that right, Amy? Okay, so it would need to be quick, but that is a rattle through. I would encourage people to go and look at the survey in more detail. There's loads more there, but I hope that was useful in highlighting some of the key issues. And as I said at the beginning, hopefully this is the start of public conversations rather than the end of it. Thank you for your time. Okay. Yep. This.
Thank you very much indeed. Absolutely fascinating data. I mean, different members of society would pay for more things. I mentioned this morning the concept of that you could have means-tested compulsory health insurance, as many other countries in Europe do. Wouldn't that take away the embarrassment for the NHS that more and more people are paying anyway? They're going to private health. So wouldn't a health insurance system, like other countries use, overcome some of those problems?
No, is the answer to that.
That saved me doing it.
I don't know if you want to answer it, Mark, but I just think that the key thing we share with all of those other countries is that the vast majority of the funding for their system comes from some form of payroll tax, and that's a good thing. It just happens to be here. It's taxation. But in those other countries, social insurance, it's a payroll tax, sure, effectively. What we don't share is the fact that all of those countries that have been listed as examples today spend significantly more on their health and social care system than we do in the UK, and that is the key factor. Those extra resources allow them to invest in primary care, public health, and social care, which is what we should be doing and moving towards. That brings us to the elephant in the room, taxation. I think, as Anma actually alluded to earlier, in terms of beliefs of younger people, there are some doubts in that cohort about the future of the NHS, in the sense of whether they believe it's going to deliver for them. The danger of that is that's a whole generation that we're in danger of bringing up to thinking that they should be looking after themselves in terms of taking out pointless private insurance policies, etc., because pointless in the sense that the vast majority of these people are healthy and they're getting bombarded with adverts to take out private insurance, but that will suck them into thinking that that's what we should be doing in the long term. Private insurance or private payment for healthcare is now at record levels, and it's still going up. And I was kind of disappointed, therefore, to see what the public's response was in terms of paying more in terms of taxation. We're all Thatcher's children now, or grandchildren in the case of some people here today. Even on the centre left, they can't bring themselves to talk about making a case for increased taxation in order to pay for the public services that we want and we need. And to me, that is the key political failing that we have at the moment. And if we don't overcome it, then what will come after is going to be even worse.
Sure. I mean, yeah, not sure that's a question for me to answer, but thank you, appreciate it. I think Rami wants to.
Thanks very much, Mark. I was struck by what I think I saw in your data, which was that there were high numbers of people saying changes to social care are needed to improve the NHS early on, but also only 15% of people saying we should take money from the NHS to improve funding in social care. Is there a contradiction there? How do we get underneath that? What's going on there?
I mean, I don't think it's a contradiction. I mean, I just don't think. I mean, this slide, I think, kind of speaks for itself, and it is probably not a huge shock to you, to Donald, or to anyone else in the room. But people don't want. I mean, I think the other bit of data you were looking at there was the one at the bottom there, taking funding out of the NHS to fund social care. People don't. I don't think that's a contradiction. I think we want better social care. We don't want it taken out of the. We want to find other ways of funding this. We don't want it to come from. We don't want it to come from social care. That's absolutely fundamental. I mean, there's loads that lies under that in terms of some of the demographic data and so forth. But it's absolutely fundamentally the case that people don't see one as being kind of making up for, in funding terms, for the perception of deficiencies in the other. Is there one down here?
Yes, we probably have time for one last question.
Thank you. Sorry if I've stolen someone else's question. I've just got a quick one. So I think on one of the slides you had like a key future concern was staff shortage and burnout. But do you think that there's a link between that and the competitive and sometimes unrealistic nature of university applications? Because I feel like that kind of suggested that the onus was on young people, but it's not that young people don't want to go into healthcare or that there's non-other standard methods of going into these jobs. I think it's more that there's such a high bar that they're being there's no morale to go into. Do you think there's a link there?
Yeah. So are you asking whether that's seeing data like that puts people off going into the? Is that what you mean? Puts people off applying to go into to work in the NHS or to work in healthcare?
I just feel like the number was so low. Like, do you think that reflects that people don't want to go into it because of universities, or just that people don't care about employment? I don't think it's the latter.
No, I don't think it's the latter either. I mean, I think there are lots of reasons why people choose or choose not to go in, but related to salary, related to conditions, related to stress. And I think I'm sure most of us in the room will know, I certainly do, family members and others who work in the NHS who feel under terrific amounts of stress at the moment and have done for a long time. So yeah, I do think things like that probably do impact. Recognition of stress. So people, what this tells me is that people experience that stress, can see that stress on people when they're interacting with healthcare in Scotland.
So I know there are other people in the room who are really keen to ask questions, but I'm really sorry we have to wind this session to a close. Apologies for that.
Thank you.